Thank you, everybody. Thank you for coming. I'm really pleased to be here, and really pleased to see people have come to listen to the briefing. So thank you for coming. My name's Claire Sampson. I'm head of our statutory SENS services. Some of you might have come across my name, seen it written on things, or maybe you've been in contact with me directly. But just for context, I've been in post around about 18 months now. I but I've worked for Nottinghamshire for about 25 years. I'm a qualified social worker by background, which means that I've worked pretty much over all of the children's teams in children's services during my 25 years with the local authority. But I'm really pleased to be here this morning presenting and talking about our new structure. So thank you. I've just got a few slides that I'm going to go through, so I'll run through those slides. It won't take me very long, probably about 10 minutes at the most, and then I'll hand over to the team to introduce themselves before us having a little bit of time at the end using the Q&A function to look at some of the questions that you might want us to answer. So just in terms of what will happen today, the session's for about 30 minutes. Like I've already said, you've got your new team here. They're going to introduce themselves. We have had to reduce the functions on Microsoft Teams for the session. The reason for that is we have to be mindful of people's confidentiality. We weren't sure how many numbers that we'd get in terms of people attending. We do appreciate that the briefings were quite short notice from when the letters came out, but we were trying to manage sort of not leaving it too long because we thought that the people might be a bit anxious and want to ask questions quickly. And that's for that reason we've said that we'll record all of the sessions, and moving forward we'll upload those to the local offer so that people are able to view them on there. So we haven't got the chat enabled either, but we have got the Q&A function enabled. So if you look along the top of your screen on the toolbar, you'll see that it's quite simply called Q&A. And if you click on that, you'll be able to type your questions into that function, and myself and the team, as we go through, will try and answer those questions. And like I said, if not, we'll hopefully at the end we'll have a bit of time to verbally look at those as well. After we've done all the sessions, we'll go back through all the questions. If we've got frequently asked questions that people have obviously we've not given the right information because the same questions are being asked time and time again, we'll create a frequently asked questions document that we'll be able to share with all parents and carers. We just ask that we're respectful of each other and supportive by valuing each other's contributions, both in the chat and obviously when we're speaking out loud. So thank you. What's happened so far? Well, you should all have received a letter last week. I'm assuming by the fact that you're here, that means that you did, and you got the invite to the briefing today. With that letter, you should have had a copy of our new structure chart, and within the letter, contact details for your team, although not necessarily for your individual workers. I know a lot of people have been asking us that. We've already done 3 briefings this morning, and I'm sure in the chat we'll show you how you can, basically if you've got the name of your worker, there is a formula that the not CC email addresses show, so we'll put that in the chat later. We've had quite a lot of feedback. Some parents and carers felt that the letters were very generic and not very personal to their children, and just by way of an explanation, they had to be this way because of confidentiality. We've currently got 6,291 children in Nottinghamshire with an education, health and care plan, and about 795 who have got open assessments. So we're getting 7,000 letters out to parents and carers, which we needed to do over a short space of time so that people were getting them at more or less the same time. So I think between Wednesday and the end of the day on Friday, we got those 7,000 letters out. And so whilst they don't reference individual children's names, we did try to make them personal from the new team managers and the new team. So everybody got a letter relevant to from their new team. We've tried to respond to as many individual questions as possible, either by email or phone call, and we'll continue to try and do that. And we've taken some learning from that as well. We know the first batch of letters went out to Ashfield, and we had some immediate feedback from those, so we rectified that straight away before we sent out the other letters. However, if you still don't think you've had the correct information, or you've got friends who also have children with plans who don't feel they've had the right information, please just let us know via the team duty email, and we will get in touch with people and make sure that they've had it. So just in terms of a little bit of context around the redesign, I'm sure many of you will be fully aware that we had an Ofsted inspection in January 2023 that told us that there were priority areas for the local area partnership, so that's health, education and social care, that needed to be addressed urgently. Ofsted came back in July 2025 to check on us in terms of those priority actions, and they told us that we were making effective progress in respect of those. But I want to make it really clear that despite that effective progress outcome in July, we still recognise that there's a lot more that we need to do and a lot more improvements that we need to make for you and your children and young people. So the redesign comes primarily from the outcomes of those inspections, but also it's a result of a piece of work that's taken place over 12 to 15 months and has included extensive consultation with staff and professionals across education, health and social care. And we've also had expertise and input from national independent SEND consultants. But primarily it's in response to your voices and the voices of your children and young people. And over the last 3 years, what we've heard you say and what we've heard you tell us through complaints, appeals, tribunals, surveys that we've sent out, pieces of co-production work, and just generally feedback from yourselves. We have to admit it's taken a little bit longer than we would have liked it to have done, but we felt that it was really important that we got it right, which is why it's a bit later than we wanted it to be. In terms of what's really underpinned, this comes from what you've told us, but absolutely fundamental to the work that we've done is that we want to improve the experience of our service for children, young people and families with SEND. And we believe that we will do that through improved being more responsive when you get in touch with us and better communication. And that we'll do that through having stronger relationships, so having a relational approach and having stronger relationships with you, your children, and also the professionals that surround your children and support them. So in order to do that, we've developed a service that has a localised approach, and that's particularly for those children who already have a plan. So we've got localised approach with local teams who are working in local communities to offer that support. We've also got dedicated focus on assessment because we recognise that we need to improve the timeliness of our assessments and the quality of our assessments also. So we believe that this structure with a dedicated assessment team and then localised dedicated plan and review teams will enable us to get much better at timeliness for assessments and reviews and improve the quality. We've got a small number of children who are educated other than at school. Those children and young people aren't on roll in an education setting. So they don't have a school or an education setting who has sort of overall responsibility for their plan. So we've got a dedicated team to provide a consistent approach and oversight for those children and young people. We've done a lot of work behind the scenes, looking at our systems and our processes, trying to make them more effective and more efficient and to avoid gaps and duplication. And we've also invested in the digital space more to try and to support with that effectiveness and efficiency. And part of the reason behind that it's to improve the experience for you and your children, but it's also in order to do that, it's to make the day jobs for our staff more doable and more achievable, given the increase in need and numbers of children and families who are using our service. So I'm just going to talk just a little bit about the structure before I pass on to Louise and Craig and the team. So what this new structure really gives us, what really underpins it, is it's got clear lines of accountability and responsibility within the service. I sit at the top of that structure, so I'm responsible and accountable for the children and young people right across the service. I report directly into our Director for Education, Peter McConaughey, and Peter reports directly into our Director for Children's Services, Anne Coyle. Underneath me, if you like, sit 3 service managers. So we've divided those up into, we've got 2 service managers who are responsible for our plan and review teams so that's all of our children and young people who already have plans. Louise Benson, Louise is going to introduce herself shortly. There she is. She's responsible for the south, so that's Broxtowe, Rushcliffe, Gedlin, Newark and Sherwood. And Rob Briggs is responsible for the north, so that's Mansfield, Ashfield and Bassetlaw. Third service manager is Louise Wright, and Louise is responsible for the assessment team, the EOTAS team, and our SEND educational pathway officers. For those of you who don't know, the SEND education pathway officers, they're our early help team. So they offer support to our families who are not yet in that statutory process of assessment and plans, but whose children have quite a high level needs in relation to SEND. So I'm going to focus on the plan and review teams because that's why you're here, and that's what the team, your children, your child or young person, or more than one child or young person are. So our plan and review, I've already talked about the localised approach. We've talked about the fact that we've got 7, we've got 1 team in each district. Each of those teams have a team manager, and each of those teams then have a number of EHC practitioners and EHC assistant practitioners. The EHC practitioners are responsible for case holding, for the operational delivery and of the content of the EHC plans, and the casework for those children and young people in their team. The assistant practitioners are there to support the practitioners to be able to do that and to deliver it. So the assistant practitioners might support with some of those more administrative tasks, but are also points of contact for families when they are getting in touch with the team. We've taken a slightly different approach for our long-term work to the one we had before. So we know that there are most of our children and young people who have education, health and care plans don't need intervention from us. Their schools or wherever, schools are more than capable of delivering what's in the education, health and care plan, holding their annual review, supporting parents and carers and doing everything that that child or young person needs. Those children and young people will be allocated to the team rather than having an individual worker. So if those parents and carers need to contact us, they should be able to speak to someone within the team very easily, because we'll have somebody on duty every day who will be able to respond to their request and what they need to know. However, we also recognise that some of our children and young people do need our support, need our intervention, and need us to be working with them. So those children and young people will have an allocated practitioner for the period of time that they need that level of support. We recognise that that's a slightly different model, that there might be some anxieties, that people might be have lots of questions about that. And what I would say is that we will keep that under review. And if it's really not working for families, then we'll be more than open to kind of reconsider that and think about how we do it differently. But we, having all the work that we've done and what we've listened to, and that part of that whole process over 12 to 15 months, we really believe that this is the best and most efficient way of our resources to make sure that the children who need our support get it. I'm sure that there'll be some questions in the Q&A. I haven't got it open at the moment because if I start seeing all the questions flash up, I won't be able to focus on what I'm talking about. But what I will do now is I will hand over to Louise and the team to introduce themselves. And while they're introducing themselves, I'll start to look through the questions and answers and see which ones I can respond to. And then, like I said, we will have time at the end. I'm getting a bit...
Well, thank you very much for coming. We appreciate that these briefings were set up at very short notice, and we do appreciate your attendance. And I would also like to acknowledge and slightly apologise for the format. You can see us, we cannot see you. You can hear us, we cannot hear you. There are reasons why that format has been allocated, but I do accept that it feels rather imbalanced, and I apologise for that. Claire talked a lot, or a bit at least, in her presentation about values and about how we want to work in a relational way. I'm not going to the dictionary, but for me, working relationally is about working together and working in partnership. Because I can't see you, I don't know if I know you, but what I do think I can say with confidence is that you will all have had very different journeys through the SEND system. And some of you will be, all of you in fact, continuing to navigate that. Some of those journeys will have been difficult. Some of those journeys will have been painful. And neither I nor anybody in my team can undo that journey or change it retrospectively. What we can do, and what we are committed to try and do, is through demonstrating by doing, not by talking, that we will establish relationships of trust with you, and there, which will enable us, we hope, to work together for the only thing that I know matters to you, and which I believe matters to us, which is the best possible outcomes for your children and young people as they move through the various stages of their educational journey. We want to be part of that journey with them and with you. We won't get it right all the time. I apologise for that in advance, but I will not apologise for the public commitment that I make to you now to try and do better together. I'll now pass over to Craig.
Hi, good afternoon, everybody. I just want to introduce myself firstly. So my name is Craig Gell. I'm the team manager for the Broxtowe Plan and Review team. So I'm the team manager for the team that your young person's EHC plan sits within. I have the rest of my team here today other than one. So I have a part-time EHC practitioner, Sarah Wolfgang, who unfortunately is not with us today. She does work part-time and she had other commitments today. I did ask her to join, but unfortunately she was not available. I will ask everybody to introduce themselves individually, but we have Emma Wilson, who is a EHC practitioner. Marcus Thomas is also an EHC practitioner, and Natasha Cowling, who's started with us very recently, who is the EHC assistant practitioner within Broxtowe. So a little bit about me. I've worked in the statutory SEND service and what previously was the ICDS assessment team for nearly 10 years now. I've worked in various different roles within the team and recently was appointed to the team manager post. And I've worked for the local authority now for 28 years this year, and prior to the my current team, I worked in social care provider teams. So I've got quite a well-rounded knowledge between social care and statutory SEND team, and I really look forward to working with you all as parents and carers, and looking to achieve really positive outcomes for your children and young people. Thank you. I'll hand you briefly over to Emma so that Emma can introduce herself.
Thank you, Craig. I'm Emma Wilson. I'm an EHCP practitioner for the team. I've been with the SEND team for probably about 4.5 years, and previous to that I was working within social care with the Preparing for Adulthood team. Really excited about the changes and hoping that you feel the benefit of the changes that we've got ahead of us. I'm a parent of neurodiverse children as well, so got a little bit of a understanding of you know what you go through and the education process and system and the impact that that can have on our young people. And that's me. I'll hand over to Marcus.
Thanks, Emma. Hello, everyone. My name is Marcus Thomas. I'm an EHCP practitioner within the team. I've worked for the County Council for the last 9 years in several different roles, but I'm now here. I'll pass you over to Natasha.
Hi, I'm Natasha. I'm really new to this role. I have a very varied background. I also have neurodivergent children, but I am really looking forward to working with you all and with the team.
Thank you very much, everybody. And as I say, Sarah Wolfgang is an EHC practitioner and unfortunately is not able to be with us today. And we do have a vacant post at the minute as well, which we have currently recruited to.
Thanks, Craig. That's great. Thank you. So I have managed to answer the questions as we've gone through them, apart from one, which I'm going to ask Craig to answer because I genuinely can't remember what the acronym MAC stands for.
So it's maintain, amend or cease decision at annual review.
Thank you very much. There we go. I won't type that into the questions, but that's the answer to one of the questions. Okay. Somebody has got their hand up. So if you'd like to put your question in the chat in the Q&A, then I can answer it for you. But apart from that, I don't think we have any. There aren't any other questions in the chat. I think I've gone through and answered them all. I think if you have got questions about your individual children, for as part of that's come out of this briefing, I've put Craig. So I think I've talked about it at the beginning. So basically, the NOTS email addresses are a person's first name dot second name at notscc.gov.uk. I have put Craig's email address in one of the responses in the questions, but if it's a question specific to your child, if you email Craig, he'll pick that up today and come back to you or direct you to the right person to be able to deal with that query. There's not many, Craig, don't worry. And then I think the person probably who had their hand up, I don't know if this was your question, but you're just saying this is the team for Broxtowe. It seems like a small team for the size of Broxtowe. Yeah, you are right. We have invested in the service. We have increased the number of practitioners as part of the redesign. But I think that goes back to our theory of wanting to allocate some children to the team rather than having individual workers. There is still a large number of children for each of the teams, but the number of practitioners in each team has been calculated based on data and the number of plans, and it's all worked out on the right ratios. Just, Craig, do you know off the top of your head how many children have got plans in Broxtowe?
621.
Yeah, so 621. But I think it goes back to that point that I said earlier. Most of our children are really settled, and the schools manage and deliver what they need, which is why they don't all need an allocated worker. But like I said, it's something that we need to continually review, and in light of the kind of increasing numbers, increasing levels of need as well. But the local authority are committed to doing that, and it's very much on their radar. Okay. Thank you very much. We really appreciate your time, and thank you for coming, and hope that it's been helpful. Thank you.